Next, I'm going to conduct a head and neck assessment. So first, I'm going to inspect my patient's head to make sure that their skull is symmetrical and their face expressions are appropriate. I am looking at the patient's skin color, noting that there is no ecchymosis, erythema, bumps, lumps noted. I'm going to palpate my patient's skull. Let me know, do you have any pain or tenderness?
No.
I'm noting that there are no lumps or bumps noted on the patient's skull. I'm looking at their hair, noting that it is evenly distributed across the patient's head. No notes of receding hairline. The patient's hair color is a dirty blonde and it is fine, soft hair. No lesions noted on the patient's skull either. I am now going to assess patient's cranial nerve 5 and 7 by identifying the patient's face and their facial expression. So if you can go ahead and smile for me and frown and puff out your cheeks for me. And I'm noting that there is no drooping noted when the patient's face is inspected. I also looked at their skin. I'm going to assess a patient's skin turgor over the clavicular area, making sure there is no tenting noted, identifying that the patient is hydrated. I am going to, their patient does not have any facial hair noted, no piercings. I'm going to assess the patient's jaw, mandible, making sure that there is no clicking or crepitus. If you can go ahead and open your mouth. There is no clicking noted, no TMJ. I'm assessing that temporal mandibular joint. And lastly, for the head portion, I'm going to assess my patient's temporal artery. I'm assessing for symmetry. Making sure that they are even and equal bilaterally, regular. Next, I'm going to assess my patient's neck. I'm noting if my patient's trachea is midline. I had assessed that from the front of the patient, noting that it is midline. I can also assess from the posterior aspect by gently palpating. Do you have any difficulty swallowing?
No.
I'm going to assess range of motion, cranial nerve 11. So if you can go ahead and shrug your shoulders for me and move your head against my hand. Like turn your head. No, turn your head like this.
Oh.
Turn your head like you're touching your chin to your shoulder. And can you move your head up to the ceiling and tuck your chin down to your chest? Can you rotate your head around in a circle? There doesn't seem to be any difficulty. I also assess the patient's strength at this time. You don't have to assess their strength at the same time, but I was able to do that while I assessed their head and neck. Lastly, I'm going to assess my patient's lymph nodes, starting with submental, submandibular, tonsillar, preauricular, postauricular, occipital, superficial cervical, deep cervical chain, posterior cervical, and if you can go ahead and shrug your shoulders so I can assess the supraclavicular. And that is the end of the head and neck assessment.